in a segregated hospital in the 1940s. Joseph Riley and his 6 siblings did not have an easy childhood in Richmond's Churchill neighborhood.
No plumbing. We had an outhouse, and heat was by stove.
But his brother James says that Joseph always kept his family smiling.
Everybody liked him. He was very likable. He liked to joke around, and he liked to play pranks on people.
Later in life, when Joseph was in need of constant care, his family put him in a government-subsidized nursing home.
He had difficulty moving around, and he had difficulty remembering things.
At Canterbury Rehabilitation and Healthcare Center, Joseph enjoyed chatting with the staff, but James remembers his brother complaining about slow response times.
He said sometimes it would take up to a half hour before somebody would respond. It's not because the staff was lazy or anything, it's just they were busy doing other things, and there was just no way to, you can't be in 2 places at once.
Last March, Joseph became one of the Richmond region's first coronavirus victims.
There was no visiting. There wasn't anything we could do.
A total of 50 Canterbury residents would end up dying from COVID-19. The nursing home's former medical director, Dr. Jim Wright, says one thing became abundantly clear to him during that outbreak.
And so instead of simply being a frustration, we have now realized that staffing shortages are essentially a death sentence for our elders in nursing homes.
Federal law does require Medicare and Medicaid certified nursing homes have a registered nurse on duty 8 hours a day, 7 days a week, a licensed nurse on duty 24 hours a day, and provide sufficient staff to maintain patient care. But Wright says sufficient is not specific enough.
You can say that we have appropriate staffing to take care of our patients if you only have one aide for 20 patients, for example. There's nothing to prevent you from doing that.
A state study completed last year found that of the 286 nursing homes in Virginia certified by the federal government, 44% of them received a below average or much below average score on staffing levels. Canterbury's staffing is rated much below average.
Staffing shortages are related to poor quality care. Increasing bed sores, nutrition problems, and things like that.
Wright also points to 2 studies published last year that showed nursing homes with poor staffing levels were more vulnerable to the spread of COVID-19.
Let's institute those minimum requirements for staffing. Let's just get the minimum so that we can protect our elders from the next pandemic.
Wright has an ally in Republican State Senator Jennifer Kiggins, who works as a geriatric nurse practitioner.
We have 4% of our population that lives in a long-term care setting, yet we've killed 40% of those people with the coronavirus pandemic. So a lot of that stemmed from just not having the proper staff in there.
For the second year in a row, she tried to get a bill passed that would impose minimum staffing requirements at Virginia's nursing homes. In fact, this is the 17th year a legislator filed such a bill. But once again, it died in committee. In the meantime, the Joint Commission on Health Care will study whether Virginia's requirements are appropriately addressing quality of care in nursing homes.
It's going to cost money to increase staffing ratios. So we know that. So it's not a very popular choice sometimes, things that cost money.
To that point, the group that advocates on behalf of Virginia's nursing homes opposes minimum staffing requirements. Their CEO, Keith Hare, declined to do an interview, but a spokesperson did tell us, quote, the pipeline of available RNs, LPNs, and CNAs simply does not exist to support providers' ability to hire the numbers of staff that would be required, end quote.
I had him cremated.
Because of COVID, James Riley still has not been able to have a memorial service for his brother. But when it comes to staffing at places like Canterbury, he says the state cannot afford to wait.
It's unfair to the people who are in the nursing home, the people who are the residents there. And it's unfair to the staff. The staff was overworked.
Now, you heard me mention some studies related to poor staffing making nursing homes more vulnerable to the spread of COVID-19. Well, tomorrow morning at 6:30 a.m., I will join our morning team to discuss those studies in greater detail. Yes, they all found that better staffing reduced outbreaks, but one of them found that there was something else that was an even greater predictor of outbreaks of COVID-19 in nursing homes. We'll talk about that at 6:30 tomorrow. See you then. Working for you, I'm Melissa Hippolyte for CBS 6.